G'day, my name's Mark. I'm from Queensland in Australia, and this is my personal story about being diagnosed with a squamous cell carcinoma, and it was on my lower lip, and the treatment now is 3 months after my last zap of radiation, and I rather than go down the surgical route, where I went radiation only in my case, for a few reasons. Anyway, this is a bit of a story about what I experienced through my journey. When I was first diagnosed, I searched everywhere for stories like mine where I had a lower lip squamous cell carcinoma that needed treatment. And from someone dealing with cancers, I wanted to get the best result, and my skin specialist said, look, if we're going to remove it surgically, we're going to have to take nearly half your lip out, quite low down here somewhere, and then pull it all together. And then it's possible I'd need radiation anyway. So he said at my age, at 64, he suggested get radiation only. It'll have a 94% chance of being totally successful. There are side effects, and most of the bad ones will probably happen in 15 to 20 years' time, more cancers, whatever. And he said, let's worry about dealing with those then when you're going to be 80 plus, and there may be new options then to look at. But the biggest thing I wanted to put over with this video is that the research I did with Dr. Google, there's a lot of stuff about head and neck cancer and radiation treatment. Most of it is not really applicable or to the same extent as just having your lower lip done with some of the specialised treatments that are available today. So I went with a treatment called VMAT, and VMAT is a very precise, targeted radiation treatment that only really did the lip area and saved my teeth, saliva glands and other things from getting exposure to excess amounts of radiation. Okay, so why this video matters. When I was first diagnosed, I searched everywhere for stories like mine, information about lower lip cancers. Someone were dealing with them, treated with only radiation, not surgery, but I couldn't find much information online with Dr. Google, radiation only. So most of the journeys are about people that had extensive head and neck cancers, or cases that required surgery and radiation. This is my way of filling that gap and hopefully giving reassurance that the path taken with radiation only is not as scary as it might sound at first. My first signs was a sore or a thickening spot on my lower lip growing to a small lump the size of a cotton bud in only a period of a few weeks. After I got a biopsy done, because it was growing quickly and it was confirmed it was a squamous cell carcinoma, I was referred to an oncology team to see what their thoughts were. Now, scans and consultations followed. I was presented with options, and I was offered VMAT radiation treatment only and rather than surgery, because it offers precision and a good chance of avoiding surgery, as a large portion, or maybe half of my lower lip, was going to need to be removed, as I said, with surgery, and that was going to have a drastic lip function, speech impacts going forward, as well as a fair chance that I'd still need radiation treatment later if the margins weren't achieved during surgery. So part of the preparation process for getting the radiation done is you need to get a CT scan done, which basically looks at your whole head and where the cancer is and other parts of it. And then they make a custom mask. Now this mask is quite claustrophobic, and as you'll see in these pictures, but basically it's designed to fit over your head so it holds your head in exactly the same position for every one of the treatments that you need to get over a period of weeks. And unfortunately it's just a necessary part of the whole deal. Okay, so VMAT stands for volumetric modulated arc therapy. It's a type of external beam radiation that delivers highly targeted doses from multiple angles as the machine rotates around you. The idea is to focus the dose exactly where it's needed, in my case, just the lower lip, and limit exposure to surrounding healthy tissue. Now, each session takes just a few minutes, totally painless, but it's precise. It's extremely precise. The mask holds you in place, and collinator focuses the beam just where it needs to go, with other things that you'll see when you get there. But look, the radiographers position you using laser guides, check alignment with CT images, and then deliver the doses while you stay completely still. My treatment process was 25 doses of radiation over a 5-week period. So each weekday, 20-minute session, only 2 or 3 minutes getting the actual dose. But yeah, it's just unfortunate that you have to be there every day, but then you get the weekend off. Okay, so the first few weeks were pretty uneventful. A little bit of swelling, some minor irritation, bit of a burning sensation. But by week 3, started getting pretty serious as the radiation builds up, and I was in a fair bit of pain, discomfort from week 3 all the way through till about 2 weeks after my last dose. I used the GoPro to capture some of the treatment sessions, and you can see how the machine moves smoothly around me. Team was always fantastic, explaining everything and keeping the process fairly calm. Physically, my lip became really raw, like a really bad sunburn. Emotionally, it was tough seeing that what's happened to your face, but I knew it's only part of the process and just had to endure the treatment to see what extent the reaction was going to be for me long term. And yeah, look, there's side effects, and you need to manage those, and we'll talk about those next. Okay, the side effects and managing them. Main one for me was mucositis. The inside of my lip became all white and inflamed and quite raw. I had a constant white layer of slough, which you had to keep rinsing off all the time. My go-to treatment for relief, keeping the lip moisturised and looking after it, stopping infection, was an ointment called QV Intensive Ointment. Fantastic stuff. And then a salt and bicarbonate rinses every few hours to clean your mouth up and keep it healthy. Now, I wanted to avoid opioids for painkilling, and you will need painkillers, where as much as possible because of constipation, blah, blah, blah. So after about the 3rd week, I discovered THC, or medical cannabis. And that was a huge difference for me. All of a sudden I was sleeping 8 to 9 hours at night. I wasn't taking any opioids or any Panadol or anything else, just the THC once a day. And while it wasn't a complete painless experience, it managed it well enough that I didn't have to turn to any of the other drugs for pain relief. Now, oral hygiene was really critical. Soft toothbrush, alcohol-free mouthwashes like Oral 7, and being very gentle that anything touching your lips. But you'll get a lot of information about that. Do whatever you need to do, but the more you do, the better. And don't skimp on it. That's so important. Okay, there's quite a few emotional and mental impacts. This experience really challenged me for being isolated during treatment, dealing with daily pain. The slow visual breakdown of my lip took a toll. But there's wins too, and the support staff, family, online resources. Once I found the right pain management routine, especially the THC, I was sleeping properly and thinking more clearly. That made the world of difference. So doing everything you can to make small improvements and keep everything under control was really important. Okay, so end of treatment. You're getting to week 5. What's next? Finishing that last ZAP, treatment 25, was a relief, but far from the end of the treatment program, as the reality is the healing doesn't start immediately. In fact, it takes 1 to 2 weeks after your last treatment before things start to go the other way and start healing and subsiding. Now, I was focused on the fullest recovery. That meant keeping up oral hygiene, seeing my dentist, watching for any side effects. Tooth decay and other bits was a bit of a risk, so it wasn't a huge risk for me because my saliva glands weren't impacted, but you still got to stay cautious about the whole thing. So after 3 months, or 3 months since my last zap, my lip now, as it is today as I'm speaking, looks fairly normal. It's got a little bit of a indentation, a bit of a red spot, but other than feeling a bit rubbery, sensitive to heat, or more sensitive to heat than it used to be, and a little bit of ulceration on the inside of the lip, which are really just small bumps, but they're painless. It's getting better day by day by day. So look, yeah, keep it out of the sun. I'm wearing a buff because I live on a boat, but managing it afterwards and not being in too much of a hurry to jump out and get back into normal life is fairly important. But don't expect it to be all good a week or two after your last treatment. It's not. It's going to take months, and in my case it took months. I was advised it would take 6 to 10 weeks, so most of that information is fairly correct. Questions and advice about what do I wish I knew going in. The worst part is temporary. It's only there for a few weeks. Look, yeah, it's not very comfortable. It's going to put your life on hold, but you just got to do it and relax, and don't try and do any more. Be guided by your health practitioner. Don't read everything Dr. Google tells you. I read way too much stuff about this because there wasn't anything I could find about just lower lip, squamous cell, radiation, VMAT only. Everything else was about neck, throat, back of throat, tongue, cancers which are treated with radiation and or surgery that are very dramatic compared to this. So yeah, don't wind yourself up about information that is not relative to your case, and really be guided by your provider. And most people get told a worst case scenario, so you're prepared for it, and in my case it was actually better than what they suggested, so it's not the end of the world. You cannot overdo your mouth hygiene, rinsing everything else. Every 2 hours, wash it out. It feels great, makes you feel good. Lots of exercise. I was walking morning, afternoon, light upper body exercise, but keep active. Don't just shut yourself down. You won't feel like doing it, but you got to make yourself do it. You come back after those walks and you feel positive again. So it's it's good. But anyway, that's about really all that's different about what I experienced. But look, thanks for watching. I hope this does help you if you're facing something similar. And feel free to leave a comment, ask any questions. For a month or two, I'll respond to them, and or share your own experience. But yeah, basically, I hope, wish you well with your journey. If you're watching this, you obviously got a similar scenario. But look, with the medicine today and modern technologies, it's all positives on your side.